We're going to be speaking on Population Data BC and the resources that we offer to researchers, the data access process, and how you can access data through Population Data BC through a wealth of resources and supports that we provide. So by way of general overview, here are the topics we'll be covering today. Who we are in terms of an institution, organization, the education and training services that I provide through the unit, and then Megan will be talking about data holdings, the data access process, and the researchers' tools and resources that are available to people, and we'll follow up with a short Q&A session at the end. So in terms of the key goals of Population Data BC, I think we can put it into sort of three categories: innovative practices, problem solving, and partnerships. So if we look at what our key goals are, we really want to be a dynamic and adaptable and provide secure data access and management processes that meet a number of parties: the public, the data providers that we serve, and the data users. In terms of problem solving, we know there's a wealth of data and lots of things are changing in the data world. So we want to provide solutions to respond to the challenges that are experienced by BC's public, private, and non-public sectors in the collection, management, and analysis of complex data, and specifically administrative data. Partnerships, we strive to collaborate and mobilize data and leverage the expertise of PopData and our partners to shape the development of innovative programs and policies for public good. And we work not only with the BC and Canadian researchers, but we also have alliances through the International Population Data Linkage Network through Australia and the UK, just to name a few. Who we are? Well, we're a multi-university data education and resource center facilitating interdisciplinary research on the determinants of human health, well-being, and development. So the key site is at UBC, where the data holdings are, data processes and data services are provided, as well as administrative staff. And myself, I'm at UVic through the geography department, and I provide the education and training services. As I mentioned, we're nationally and internationally recognized as a leader and strive to provide researchers with data access, data linkage, and analytic training services. And we've been doing that for over 20 years. So I think we have a wealth of information and experience to share with many individuals. In terms of our services, we can look at them in terms of four categories: data access for research, data linkage, secure data storage and archiving, and education and training. So as the education and training lead, I'm going to talk about those services today. So categories of services that the unit provides: free online resources, and these include online workshops, best practice documents, presentations in terms of numbers of series, workshops, and a lot of things that we post on our YouTube channel that are all free and open to individuals from any walk of life. In-person workshops and webinars, and these are usually fee-for-services webinars or workshops on topics such as statistical analysis, data visualization, and data cleaning and management, just to name a few. We also have a professional specialization certificate in population health data analysis, and this is offered in partnership with the University of Victoria in Continuing Studies and the Department of Geography at UVic. Just some examples of the free online resources that we provide: administrative data, spatial epidemiology, GIS and epidemiology, space-time disease surveillance, and various statistical analysis courses. And these are accessible with a free online account through PopData. And once you're in our education and training site, you can watch videos, read documents, and a number of our courses have a research training lab where you can actually go in and practice some of the things that you've seen through the videos. And this is accessed through VPN and remote access. We also have best practice documents. A few examples would be mapping health data, an introduction to RStudio for SaaS users. And we have a couple of webinar series that are going on right now. One is in advanced methods in the use of administrative population health data, and the other is power of population data science. And you can find all of the recordings for these on our YouTube channel. And if you sign up to our newsletter, we'd be happy to add you to our list of those who join our free webinars. One of the mainstays of the services that the Education Training Unit offers is the Professional Specialization Certificate in Population Health Data Analysis. It has 6 courses, but 4 courses are required for a certificate. This is a non-credit certificate offered through the University of Victoria Continuing Studies, but it's very much a hands-on training and very much for professional development of researchers, population health professionals, graduate students, looking for applied hands-on training. So the theory component is offered through UVic's Desire to Learn learning platform, and the analytic component is offered through PopData's Secure Research Training Lab. So very, very applicable, very applied, and very useful for many individuals looking to advance their skills in population health data analysis. In-person workshops and webinars, just a few examples here again. Structural equation modeling, Bayesian disease mapping, hierarchical and multi-level modeling, competing risk analysis, and latent variable modeling. These kinds of workshops, usually if they're in person, usually run for 2 to 3 days and are very intensive and, as I said, always very applied. Webinars, a few examples of our recent ones: Introduction to Data Management and Cleaning for Analysis, Linear and Logistic Regression, Survival Analysis, and Introduction to RStudio for SaaS users. These are webinars that commonly run for 2 hours, and the sessions are commonly 4 to 6 sessions in total. We have a new data access request training that's happening at the end of July that I'm very excited to talk to you about, because it applies a lot to what Megan's going to be talking about in the next section of our presentation. So this is just a quick overview of the training that's going to happen at the end of July. It's 3 sessions, 2:30 to 4:30. And it's very much focused on people who want to learn more about PopData's data access request process, the tools and resources that are available to you to make your way through this process. It also highlights the do's and don'ts of how to go about this process and how to define your cohort, select variables, and familiarize yourself with approval process, costs, and timelines, all the things you need to know to get started. So I hope if you're interested in this, you're able to join us. It's going to be a free workshop, and as I said, held over these 3 dates. So that's the end of my presentation, and I'm going to hand it over to Megan. Thank you, Megan.
Thanks, Anne. So for my part of the presentation, I'm going to go over data access for research, data linkage, and secure data storage and archiving at PopData. So at PopData, we hold approximately 5.1 million British Columbia health records for the population of British Columbia. And the amount of data we hold on any one person depends on their life course and the services they have interacted with within the province. So for example, a 26-year-old male who was born in France and became a Canadian citizen at 9 would be in the citizenship or in the immigration and citizenship data. And they have high blood pressure. So they might have been going to the doctor on a regular basis. So they would have had physician records. Maybe they went to the hospital for that as well. So they might have hospital data. And unfortunately, they also broke their leg at work. So they would have had to go to the hospital for that. So they would be in the hospital record. Those records would also be on WorkSafe BC because that accident took place at work. And this individual also got married. So they'd also be found in the statistics vital statistics married data file. While if you look on the last example on this slide, a 66-year-old female who was originally from another province that moved to BC has only had a few physician visits. So she would only be found in the medical services file for that. So you can see as individuals go through their life course, depending on how long they've lived in British Columbia and their health conditions and how they've interacted with the health, education, judicial, and other systems within the province will depend on how much data there is on any one individual. So this slide gives a a breadth of our internally managed data holdings at PopData. So we have a large health component to the data holdings that we have. So we have everything from 811 data, from phone calls to that, to exactly what I was talking about before with physician visits, hospital visits, drugs that have been dispensed for individuals. We also have demographic data on British Columbians, education data, work and income, environment data, and we also have social data. And at PopData, we're always working on liaising with other data stewards to bring in new data into PopData to become an internally managed data holding to make it available to researchers. In addition, I was moving ahead one slide. So this is just a snapshot of the data holdings that we do have at PopData. So you'll see that a lot of them go back to the mid 1980s, 1990s. We have some that are more closer to now. So for example, BC Generations Project just started in 2009. So we only have data from then. And for example, COVID-19 data, we only have data back from 2020. So depending on when the data set started, that's when we'll have data. And then data is always getting added to all of these data holdings. And each of the data holdings have different amount of records, as you can imagine, depending on how many person level data files are within that file. So you'll see on the very top medical services plan, these are doctor visits. There's 2.5 billion records within that. And even though the population of British Columbia is only 5.1 million individuals, we have a lot of records within those files, since it's each visit that you have with a physician that's within that file. We also have researcher collected data. We have over 70 projects that have successfully linked their researcher collected data to the administrative data holdings that I just spoke about. So you have to have specific things in place in order to do this, predominantly a consent form that outlines how that linkage will occur. And that consent form has to be approved by the data stewards for the other administrative data sets, like the hospital data and physician data sets that you want to link with. But you are able to do that through PopData BC, and we have many projects that have been doing that. So I want to spend the next little bit of the presentation is just going over the data access process. So this is what you would experience if you come to PopData wanting to get data for a research project. So prior to filling out the data access request form, you would reach out to PopData and we would determine if your study was feasible. So if the cohort that you're wanting to look at, that we have data on that the cohort size is large enough in order to do the data analysis, and then we would work out a cost estimate for how much it would be to extract that data for your research project. And like I mentioned, just with researcher collected data, we would review the consent form to ensure that all of the relevant information that needs to be in that consent form is within that, so that we don't run into any problems once we want to link that data down the road. And we also have various planning tools that you can use on our website for planning a DAR, and I'll touch upon those at the very end of the presentation. So after you go through some of those preliminary steps, you'll actually fill out the data access request form. So you'll do that on our DAR Online platform. And so this is various pieces of information, from identifying information about your study, methodology, your research team, ethics, peer review, funding, how you're going to store the data, how you're going to analyze the data. And this is just a really complete picture of your project that will be reviewed by data stewards. And you'll work with the data access unit at PopData to complete that application, so that it is complete once it goes to data stewards. So once it gets to data stewards, they'll review the application. They might come back to you as a researcher and ask clarifying questions, or ask you to collect some additional information prior to approving your project. In very few cases, they'll reject a data access request. It's usually if there's a for-profit funding or some other nefarious aspect that's part of the application, but the vast majority of ones are approved. And then after it's approved, there's some administrative things that we have to go through. So there's research agreements and service agreements that need to be signed, which just outline how the data will be used between the researcher and the data steward, how it'll be held, how it'll be analyzed, what you're able to do with that data. There's confidentiality pledges that need to be signed, privacy training that needs to be completed, and then we set up the account on the secure research environment so you're able to access your data. And while all of that's being done by the data access unit, the data service services unit at PopData BC is actually defining your study population and linking your data for you. And once those extracts are done, they're available on the secure research environment that we host at PopData. So when we do link the data, we separate the identifying information from kind of the meat and potatoes of any one data set. And we clean up that identifying information. So for example, a birth date might be incomplete. It might say somebody was born in 2050. Clearly that's incorrect. We'll cross-reference that with another data file to ensure the birth date is correct and do some other data cleaning. And then there's two types of linkage we can do: deterministic linkage, which is just linking on one identifier. So for example, your personal health number or a study ID, or probabilistic linkage, where we look at many forms of identifiers, so first name, last name, birth date, and your personal health number, to really ensure that we got the correct linkage between all of the data files that you're trying to link for any one study. And you can do linkage in two ways. So you can follow one person through various files. So like I said before, you could follow the 26-year-old male through like the marriage file, the physician file, the hospital file, the income file, or you could do a longitudinal study where you're just looking at one person as they go through like the hospital system. So if you had somebody that was born with a heart condition and you wanted to follow them through one hospital file and see all of their interactions with the hospital system over their lifetime. So two different types of linkage, and we're able to do many different types of linkage depending on the type of research study that you're doing. And we all do this within the secure research environment. And the secure research environment provides a secure storage and backup location for all of our data. It's one centralized location for access and processing of research data. And we provide a range of software for researchers to use to analyze their data. And all of this is done to the security standards of data stewards. What that will look like for the researcher is you'll sign on a VPN and you'll get to use a little UB key that sticks into your computer, and that's a two-factor authentication, and that's how you're able to access the secure research environment. And then we have various firewalls and secure storage sites at PopData BC, but for the researcher itself, it's just signing on to a VPN within Canada and two-factor authentication. We have various other measures to ensure security. Security is very important for us at PopData as well as our data stewards. So only named researchers have access to data. You fill out confidentiality pledges. There's mandatory privacy training. Data can only be used for the requested purposes that are outlined in your data access request form. And when you're trying to get data out of the secure research environment and into reports, presentations, transcripts, manuscripts, whatever that may be, it has to actually be pre-vetted by the data stewards beforehand so that we can ensure that there's no gross misuse of data. And then finally, data is archived and destroyed upon closure of a project. So once your data is it's within the secure environment is when it gets really exciting and you can do all of your data analysis. And what happens sometimes is you'll be doing your data analysis and you determine, oh, I forgot a variable, or actually I want to actually link in prenatal or perinatal services, or I was thinking of a 3-year study, but I want to do a 6-year study. So we can put in amendments to data stewards, we can submit data retention extensions, to do all of those things that I mentioned, to add variables to extend your research study. And during the course of your research study, you'll have to keep ethics and funding up to date and have all those approvals in place. And then, as I mentioned, you'll have to, all of your research outputs that you want to put in manuscripts or reports will have to be vetted by data stewards prior to that. And then at the very end of your study, you'll have to archive the data, destroy any data that we deem needs to be destroyed, and then there's some other contracts that need to be signed. But that's what the whole data access process looks like. I just have a couple more slides. I know that I'm at time and I want to provide some time for some questions. So how long does it take from DAR submission to data delivery? We strive for 3 to 6 months. Sometimes it goes over that for various reasons. Sometimes we're liaising with an external data steward and it's taking a long time. There's mistakes in the data access request, and sometimes there's just a delay with data steward review. But we've put many things in place at PopData recently to speed up that approval process. We just launched a new streamlined DAR, and as Anne was speaking speaking about the DAR training that will actually go through all of that, the new DAR. It's just a way more streamlined, concise application for researchers to use. And we've also launched core data, PopData, which is for many of our data sets, you're able to get a core set of the variables that have already been pre-vetted and have and data stewards believe that it's safe for researchers to get that without having to request it. You have to still fill out a data access request form, but it's just a lot more streamlined process. So we have various other tools that you can use on the PopData website. So App Tracker is actually all the project truth for your project. So data retention, ethics, all your pre-publication reviews go through that. And I just wanted to touch upon briefly Metadata Central and BC Data Scout. So these are tools you can find on the PopData website, and it's able to give you a little bit of information about variables that we hold, their quality, how much frequency we have for that, when they got introduced into data sets. And BC Data Scout, you can actually find the cohort that you're using for your study. You can actually get some aggregate information for that cohort, so that you know when you're writing your funding application or you're getting started to do your study, you know what your sample size is going to look like. So as a result of all of this, we're able to provision data for a lot of exciting research projects at PopData, anything from looking at how pollution affects health, to COPD, to pregnancy outcomes, and obviously really pertinent right now is a lot of COVID-19 research that is going on at PopData. So that's the end of our presentation. Anne and I would be very happy to answer questions that anyone may have.